Hey everyone, Dr. Michael Corsellis here today. I want to talk to you about cancer screening. It's October, which is Breast Cancer Awareness Month, so I do want everyone to be aware it's the importance of screening for breast cancer. So, if you know friends, family, loved ones who have breast cancer in the family, for sure they have to get screened sooner than others. But for everyone else, yeah, for women should get screened for breast cancer. 1 in 8 folks are getting diagnosed with breast cancer nowadays. Um, but there's also certain cancers we screen as well during our annual physicals. So I always encourage our patients to do their yearly physicals with their primary care providers, whether here or at their PCP. At the annual physical, we are screening with questions, looking at your health, looking at your family history, and looking at how you eat and how you exercise and those kind of things. So, yeah, breast cancer is important to do breast exams, mammograms, breast ultrasounds. I usually recommend both of those when you're due. So I usually recommend like age 40 and up. Sooner if there's risk factors going on. When it comes to guys, we usually check for testicular cancer and prostate cancer. Testicular cancer tends to happen at a younger age. On average around 30s or so, you can get testicular cancer, but it can be earlier on or much later on in life. When it comes to prostate cancer, everyone's favorite digital rectal exam to check the prostate. We should start checking those around age 50. Sooner, of course, like age 40, or even if there's symptoms of prostate cancer, which can be like urination issues, blood in the urine, problems starting peeing, stopping peeing, or family history, we'll do that sooner. But folks on average will check around age 50 or so. Now, for everyone, we're always trying to screen for colon cancer as well. And so once you hit age 50, that's when we usually recommend a screening colonoscopy at the gastroenterologist's office. And so when you get that referral, you talk with the GI doc to talk about screening. It's usually not the procedure itself that everyone sweats. It's the prep beforehand. You got to drink that solution, which cleans you out. But part of that annual screening exam at the general physical, we are doing those exams. And I also forgot to mention PAPs. Make sure women get PAPs. You're screening, doing a pelvic exam, but you're also doing the PAP, or PAP smear, which is checking for cervical cancer. We also do looking at people's skin checks. Are there unusual, suspicious lesions that you're noticing? But the biggest trend to watch out for when it comes to cancer are changes. So our body's exposed to cancer cells all day, every day, but our body is designed to target, identify, and kill cancer cells. There's some folks where there's been genes or something in the environment where our body stops detecting the cancer cells and the cancer starts growing uncontrollably. And so that's why you have to look for changes. So for skin cancer is what's your sun exposure, where you're out in the sun all the time, you don't use sunscreen, but now do you have this lesion that's looking, you've had for years, now it's doubled in size, has a weird border, weird color, weird texture, not healing, that kind of thing. That's a concern for skin cancer. Have it checked out. A lot of times we'll biopsy those lesions, we'll basically cut it out, throw a couple stitches in, and send it out to the pathologist's office. And then the other thing is, on the exam, we're checking your vital signs, your weight, what's your BMI, how's your diet, and how's your lifestyle. So we do have some patients requesting a full battery of tests. And we do some lab work, but we don't do like a shotgun approach, checking every single thing. There's cost involved, but sometimes if you're doing, for example, a full MRI of the body, you're going to find something. And more often than not, it's an incidental finding. It's a benign lesion, nothing to be concerned about. But when you start doing the shotgun approach, yeah, you're going to find something. And a lot of times we don't know what it is. So it just causes more stress. So you do have to use work with your provider on the best medical judgment and work together with them on, do you need to pursue further testing? Do you have changes? Talk about the skin cancer. Other changes to be aware of is for colon cancer or rectal cancer is like, how are your bowel movements? Is it 1 a day, 2 a day? Now all of a sudden you're going 10 times a day? Is there blood? For breast cancer, is a suspicious lump going on? Testicular cancer, is there a lump down there? A lot of times these are painless lumps. It's just the cells growing unchecked, and definitely should get those evaluated. So those are just a few of the things we usually screen for. I forgot to mention there are genetic tests available for certain cancers, so we do offer that for patients. It's a blood draw that you can do. There's pros and cons for doing genetic tests. Do you need to know? Will you make those changes? Does it cause unnecessary stress on you? Or like, yep, there's a strong family history. I need to know and for sure make those changes. So genetics is a component when it comes to cancer, but you also have to be aware of the lifestyle and other aspects outside of genes. Right? There's a rise in cancer, not because we're just detecting it more, but there's a rise in cancer rates because of all the lifestyle things, increase in sugar, increase in stress. Stress is huge at weakening the immune system, and all of a sudden the cancer just starts growing. So we have to stay on top of stress, but we also have to stay on top of our diet. So a lot of fiber, fruits, vegetables, none of the refined types of sugars and carbs and all the junk food that everyone's addicted to. And then we also have to exercise. So exercise is key. So it's the balance of diet, exercise, and stress reduction. And it's not just all genetics. You got to look at both of those components. So hopefully this makes sense. Just a quick sense on cancer screening, tests available out there, and we'll talk to you guys later.